Okay, so you sent over this really interesting piece from Observer Point, sleep apnea, understanding the risks and finding solutions.
Hmm.
And that's exactly what we're going to try and unpack today. Basically, pull out the key stuff you need to know.
Right, distill it down.
Yeah, what is sleep apnea? Why should we care? And, what does the article suggest we can actually do about it?
And it's important because, as the article points out, millions of people have this, often without even realizing it.
Right, it's not just feeling a bit groggy in the morning. It can be more serious than that.
Definitely. That fatigue, or maybe heavy snoring, it can actually signal these repeated stops in breathing while you sleep.
Which means you're not getting that deep restorative rest.
Exactly. And that lack of good sleep, well, it comes with some significant health risks, according to the piece.
Okay, let's get into the nitty-gritty then. What's actually happening biologically, I guess,
Yeah.
during these apneas, these breathing interruptions?
Well, at its core, it's just that. Your breathing literally stops, then starts again, over and over.
And the article said, how often?
It can be dozens, even hundreds of times an hour in severe cases. And these pauses, they can last a few seconds or sometimes, shockingly, up to a minute or more.
Wow, hundreds of times an hour. It's hard to imagine getting any real rest like that. What does that do immediately, like in the moment?
The immediate problem is your blood oxygen level drops. Your body senses this danger,
Okay.
and it triggers a brief awakening. It's usually so quick you have no memory of it.
But it's enough to pull you out of deep sleep.
Precisely. This constant cycle oxygen dip, brief wake up, breathe again, fall back asleep, repeat. It just prevents you from staying in those crucial restorative sleep stages.
So your body's working overtime all night, even though you think you're asleep. The article mentions different types too, doesn't it?
It does. There are three main ones. The most common by far is obstructive sleep apnea, OSA.
Okay.
That's where the muscles in the back of your throat relax too much during sleep. They sort of sag and narrow or block the airway.
Like a physical blockage.
Exactly. Then there's central sleep apnea, CSA. Less common. Here, the airway isn't blocked, but the brain, it doesn't consistently send the right signals to the muscles that control breathing.
So it's a signaling issue.
Right. And finally, there's complex sleep apnea syndrome, which is basically a mix of both. You have both obstruction and those central signaling problems.
Okay, let's focus on the obstructive kind, OSA, since it's the most common. Can you walk us through a typical episode? What does that look like?
Sure. So you fall asleep, your throat muscles relax, maybe a bit too much.
Mm-hmm.
The airway narrows or even closes completely. Airflow stops or it's drastically reduced.
So then the oxygen level dips.
Right. Your brain detects this, panics a little, and sends an alert. It wakes you up just enough, maybe just a shift in sleep stage, to tense those muscles and yank the airway open again.
So you take a breath, maybe gasp or snort.
Often, yeah. And then you fall back towards sleep, and the cycle can just start all over again. It's relentless for some people.
And, like you said, often you don't remember these little awakenings. Which must be why, as the article notes, so many people are unaware they even have it.
That's a huge part of the problem. You don't remember waking up, so you just feel tired or off during the day and might not connect the dots.
So recognizing the signs is key. What are some things the article mentions that, say, a bed partner might notice?
Yeah, the partner is often the first witness, you could say. Very loud, chronic snoring is a big one.
But not just regular snoring.
No, it's often described as disruptive snoring, sometimes with noticeable pauses where the breathing just stops, followed by maybe a loud gasp, snort, or choking sound as breathing restarts.
Okay, that sounds pretty alarming if you hear it.
It can be. They might also notice the person being really restless, tossing and turning a lot.
And what about the person themselves? What symptoms might they experience during the day?
The classic one is excessive daytime sleepiness, feeling really wiped out even after a full night in bed.
Makes sense.
Also, waking up with headaches quite often, difficulty concentrating, memory problems, feeling more irritable or having mood swings.
Interesting how broad that is.
Yeah, and also waking up with a really dry mouth or sore throat, needing to get up and pee frequently during the night. Even reduced libido can be linked. It affects a lot.
That's quite a list. It really highlights how it's not just about sleep. The article also dives into risk factors, right? Who's more likely to develop this?
Yes, there are several key factors. Obesity is a major one. Extra weight, especially around the neck area, can physically narrow the airway.
So neck size matters.
Neck circumference, yeah, that's a known indicator. Also, having a family history suggests there might be a genetic link.
Okay.
Men tend to develop it more often than women, although women's risk increases after menopause. Older age is another factor.
And lifestyle?
Definitely. Smoking can worsen it. Using alcohol or sedatives, especially before bed, can relax those throat muscles even more. Even things like chronic nasal congestion can contribute. And certain other medical conditions can increase risk too.
So it's a combination of things: anatomy, genetics, lifestyle.
Pretty much, yeah. A mix of factors often come together.
Okay, so we've talked about the disrupted sleep, the tiredness, but the article really hammers home the serious long-term health risks. Let's talk about those. What are the big dangers?
This is really crucial. The repeated oxygen drops and the stress response this triggers. It puts immense strain on your cardiovascular system over time.
How so?
Well, it's strongly linked to high blood pressure and significantly increases the risk of having a heart attack or a stroke. The body is just under constant low-grade stress all night.
That's pretty scary stuff. And it's not just the heart, is it? The article mentioned metabolism, too.
Absolutely. There's a clear link to metabolic problems. Sleep apnea can worsen insulin resistance,
Which it leads to.
increased risk of developing type 2 diabetes. Plus, that disrupted sleep messes with hormones that control appetite, like ghrelin and leptin.
Ah, so it can make you hungrier or feel less full.
Exactly. Which can contribute to weight gain or make it harder to lose weight. And since obesity is a risk factor, you can see how it becomes this vicious cycle.
Yeah, that makes sense. What about mentally? The impact on the brain?
Well, chronic sleep deprivation isn't good for the brain, period.
Mm-hmm.
With sleep apnea, people often report significant issues with concentration, focus, and memory. That daytime brain fog.
And mood.
Yes, the article also points to a higher risk of depression and anxiety. Whether it's a direct effect of the sleep loss, the oxygen dips, or just the overall stress of the condition, it definitely impacts mental health.
So physical health, metabolic health, mental health.
Mm.
It seems to touch everything. Are there other risks mentioned?
The article briefly touches on a few others, things like potential liver problems, fatty liver disease seems more common, also increased risks during surgery and with anesthesia because breathing is already compromised,
Right.
and just overall, a significantly diminished quality of life, less energy, mood issues.
Yeah.
It just impacts your ability to function well day to day.
Okay, so given this whole range of quite serious consequences, it sounds absolutely vital to get checked out if you suspect anything. What does the article recommend for diagnosis and treatment?
First step, definitely, is talk to your doctor. If they suspect sleep apnea based on your symptoms and risk factors, they'll likely recommend a sleep study. The formal name is polysomnography.
That's the overnight test.
Usually, yes. You go to a sleep lab, or sometimes it can be done with equipment at home now.
Mhm.
They hook you up to sensors that monitor things like your brain waves, heart rate, breathing effort, airflow, oxygen levels.
Works.
Pretty much. It gives a really detailed picture of what's happening while you sleep and confirms the diagnosis, plus how severe it is.
Okay, so once you have that diagnosis, what are the treatment paths the article lays out?
The most common and often most effective treatment, especially for moderate to severe cases, is CPAP.
That's the mask thing.
Yeah, continuous positive airway pressure. You wear a mask over your nose or nose and mouth, connected to a machine that gently blows pressurized air into your airway.
And that keeps it open.
Exactly. It acts like an air splint, preventing that collapse. It can be incredibly effective.
Are there other options? Maybe for milder cases.
Yes. For mild to moderate OSA, oral appliances can work well. These are like custom-fitted mouth guards, usually made by a dentist trained in sleep medicine. They reposition your lower jaw or tongue to help keep the airway open.
Interesting.
And lifestyle changes are huge. The article stresses weight loss, if applicable. Losing even a moderate amount of weight can sometimes significantly improve or even resolve milder cases. Avoiding alcohol and sedatives before bed, quitting smoking, those help too.
In surgery, is that common?
Less common. It's
Yeah.
usually reserved for specific cases where there's a clear anatomical issue, like very large tonsils or issues with the jaw structure that can be surgically corrected. It's not typically the first line of treatment.
So quite a few avenues depending on the person and the severity.
Definitely. The good news is that effective treatments are available. It's not something people just have to live with.
Okay, so pulling it all together from this Observer Point article, the big takeaway seems to be sleep apnea is common, it's serious, and ignoring it can have some pretty major health consequences down the line.
Absolutely. Recognizing the signs, the snoring, the pauses, the daytime fatigue, the headaches, all those things we discussed, that's step one.
Both things you notice yourself and things maybe a partner points out.
Right. And if any of that sounds familiar, the clear advice is talk to a doctor, get it checked out properly.
Because, as the article highlights, treatments do work. They can improve your sleep dramatically and, importantly, reduce those serious health risks we talked about, the heart issues, diabetes risk, cognitive problems.
Exactly. Getting good sleep isn't a luxury, it's fundamental to health. Treating sleep apnea is really about investing in your long-term well-being.
It really is fascinating how something happening while we're unconscious can ripple out and affect, well, everything else.
It truly underscores how vital that restorative sleep process is for pretty much every system in the body.
So here's maybe a final thought to leave folks with, something to chew on. Considering just how crucial good restorative sleep is for our overall health, our mood, our energy,
Yeah.
what's maybe one small thing you could do this week just to check in on your own sleep?
Yeah, maybe it's asking your partner if they've noticed anything unusual, like loud snoring or pauses.
Or maybe just reflecting honestly, how tired do you really feel during the day? Just tired? Maybe something more? Definitely food for thought and perhaps a conversation starter with your doctor if needed.